Welcome to this PowerPoint presentation on the positive and negative psychological effects of anabolic steroid use. Anabolic androgenic steroids, or AAS, can be also known as anabolic steroids. They are synthetic derivatives of the male hormone testosterone. They are also designed so that their presence in the bloodstream is prolonged. They have two effects. The first one, anabolic, which increase muscular strength and size. The second, androgenic, which is a masculizing effect. Both of these are quite evident to the sight when you see someone that has been taking AAS. AAS also has many nicknames. Most common one is the juice. The juice can be taken orally, injected, or transdermal. There are many pitfalls with the way people take these. With injections, there is a case where people can rupture blood vessels from poor injection, from not injecting into the muscle, and also infection from sharing needles. With taking the pills orally, you can cause an upset stomach, and the use of other ancillary drugs may be needed to combat any side effects from this. Why do people take steroids? Well, a few of the things people use it for is to increase their body mass, an increase in muscular size and strength, and also to increase the number of red blood cells. As we know, with an increase of red blood cells, you get an increase of oxygen, which is a major part of to increase your performance. There are a few negatives. You get lower LDL, an increased risk of prostate cancer, aggression, mania, to name a few. There have been many studies done in the field of positive and negative side effects. The first study was completed by Fasalo and Ulrich in 2010. There was 39 male participants, 33 of which were former Division I athletes. At the time of the interview, 5 men were continuing to use AAS. 37 of the men perceived the use as positive. One of the men saying, "Oh, positive for sure, because I kept my spot in baseball, I developed a chiseled body, my grades went through the roof. I never got a better grade point than those semesters I used the juice." Other positives recorded were a significant increase in muscular mass, strength, and perceptions of well-being. Interestingly enough, 33 discontinued the use due to priorities such as family and becoming businessmen. The second study was compiled by Hildebrandt, Lahnbücher, Carr, San Juan, and Park in 2006. What they were doing was predicting the intention for long-term use of AAS among men. All the participants were aged 18 years and older, and 80% of the sample reported at least satisfied with AAA use. There were some positives, an increase in self-esteem of 88.1% of the participants, more power by 64.6% of the participants, and better concentration by 55.4%. Some of the negatives reported was water retention, excessive sex drive, acne, testicular shrinkage, and difficulty in sleeping. Use of ancillary drugs were also reported to be needed to combat some of these side effects such as acne, and the use of ibuprofen to calm any sort of pain in the joints and muscles from the excessive growth. Out of the 500 male participants, only 11 participants reported no psychological side effects. In the third study, also in 2006, they were investigating the psychopathological effects of self-administration of doses in a group. Of the three groups, Group A took the control, which meant they take nothing, Group B took the placebo, which had no effect, and Group C were users of AAS. Group C showed an increase in hostility, guilt, aggression, criticism, and name some of the others. Group A and B showed no significant increase in psychopathological effects. Males are not the only ones that take AAS. Females also take them for the extra performance edge, such as Marion Jones. Marion Jones was a multi-Olympic medalist in track and field. She was never caught in competition with testing, but only through admission of self-guilt was she caught, and subsequently she was also sentenced to a jail term for perjury. Female bodybuilders also take these, mainly for the androgenic effect as well as the anabolic effect. The androgenic effect is quite evident in the female when they do take AAS. Some of the side effects being deepening of the voice, male pattern baldness, growth of facial hair, also male-like features in the face and hands, increase obviously in muscular size and strength. Some of the female-specific stuff will be an altered menstrual cycle. If we take a look at perhaps the most extreme example of effects of anabolic steroids in women was the case of Heidi Krieger. Heidi, a victim of a state-sponsored attempt to build a country of 16 million into a sports power rivaling the United States of the former Soviet Union, began taking anabolic steroids orally when she was 16 years of age. She was told by her East German coach to take this little blue pill, which was a vitamin, which would increase her strength. The results were outstanding. At 16, she threw a shot put just over 46 feet. 3 years later, weighing 200 pounds, she threw the shot 65 feet 6 inches at the 1986 European Women's Shot Put Championship. Confused as a teenager about her sexuality identity, she had later had a sex change operation and became known as Andreas. So in conclusion, the mounting evidence, both research and medical based, that support that there is way more negatives than positives when it comes to psychological effects. Should people really be taking these? If you're an athlete, do you want to be labeled as a cheat just because you want to get that small bit of competitive edge? Take a look at the picture below of the two very famous athletes. Mentioned before was Marion Jones on the right hand side, and very famous Lance Armstrong, who recently came out admitting that he had taken performance enhancing drugs and anabolic steroids. With their careers over now and careers in tatters, do you think was it worth it? Would they have their time over again? I think they would. Thank you for listening. The last 2 pages contain references of all the information in this presentation. Thank you.